What's going on, everyone? In this video, top surgery prep part 1, I'm going to be talking about some physical and mental ways to prepare for top surgery, and I'm going to do a part 2 more so about the things that you'll need to buy and have on hand for afterwards. So for those of you who don't know, I'm almost 9 weeks post-op, and I feel really good. I feel like everything is healing really well. And I just want to share some of the things that I've done that I think have really helped my healing process. I've basically gone through the whole thing pain-free from the moment that I woke up from surgery, and still 9 weeks out, I have not had any pain. My highest pain level was like a 3 waking up, and I really attribute a lot of that not only to having a wonderful surgeon, but also to what I did to prepare myself for surgery. So getting into it, I will start off with your habits. Healthy eating habits, healthy mindset habits, and healthy exercise habits. So you don't need to be, a world-class athlete. God knows I'm not. But it is good to be active and to work out. It really helps with your circulation, which is a big deal when it comes to your nipples. Nobody wants to lose a nipple. And just your circulation helps your scars heal, everything else. So it's really important that you kind of get into. I know it seems like maybe I don't want to start working out right before surgery. I'll start working out afterwards. However, if you start working out before surgery, you're going to feel better about your results afterwards. And it is often recommended to work out before surgery, maybe lift weights, and to kind of build up a good amount of chest muscle if you can. And that is going to really help your surgeon kind of know where to sit your nipples and everything else. All surgeons have their own style and everything, but the more muscle you build beforehand, the better result you're going to have afterwards. And that goes along with burning fat. I have a bunch of fat, so now that I don't have my chest, I get a little more self-conscious about my love handles and things like that. The gym was shut down for me before I had my top surgery because of COVID, and I was working 60 hours a week, so I really didn't get a lot of exercise or weight training in right before surgery, and I wish that was different because I feel like I would have felt a little more body positivity had I made my body more so what I wanted. But thank you, COVID, for ruining my gym life. At least try to eat healthy, try to eat good foods, and you're gonna have a better experience with your body healing and everything else. That's gonna bring me to yoga. So you can work out in the gym, you can lift weights, everything else, do cardio, blah, 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 this and that. I highly recommend yoga. Not only does your body feel good, it's good for your mind and everything else, but in this case, for top surgery, I really, really recommend it because it's going to give you some extra flexibility and stability that you're going to need. After you have top surgery, you really can't use too much of your upper body. You guys know that you're going to be T-Rex arms, everything else. You're going to have drains probably, all that. And you don't really realize, I'll tell you this, you don't realize how much your chest muscles come into play until you can't use them. So pretty much any movement you're doing with your arms or anything else, your chest is working. It's constantly working. So the reason I really recommend yoga is because you're going to have to use your legs a lot more. But you're not going to be able to use your upper body. You got to roll out of bed. You're going to need to use your legs. And you're probably going to you're going to move around in kind of weird positions that, with yoga, you'll get a little more flexible and be able to kind of wiggle yourself around and position yourself without putting any pressure or force on your chest. And I think that's a really big deal. it really, really helped me, and I enjoyed yoga to begin with. I really liked the stretch and just how my body felt throughout the day. But if you're like, I really suggest doing it before top surgery, and you're gonna find that you're gonna be able to shimmy yourself here and there a lot easier. So what else do I have? Talked about healthy eating. Vitamins. I took vitamin C and vitamin D. I take daily anyway, but they're gonna help your immune system a lot, and you're gonna want a healthy immune system. Despite COVID and everything else, you're going to want a healthy immune system going into any kind of surgery, especially this one. So I definitely recommend taking some vitamins. I'd start them a couple months before so that they're in your system. You can really build up your immune system that way. Vitamin C and vitamin D. I also took collagen because collagen helps to keep your skin elastic, and that's going to help as far as, you know, an overall better result on your chest. Elastic skin is key. Of course, discuss this with your doctor. I know that my surgeons, the hospital called me before and asked me if I was taking any vitamins, and I listed off what I was taking. So please, if you are going to take vitamins, make sure you let the anesthesiologist know. They should double check with you beforehand and everything else. These vitamins don't affect it. I did see that vitamin E was on the list not to take. I don't know why, I didn't ask, but it seemed a little bit strange to me. Could do something with your blood, I'm not really sure. Another thing you can do to prepare physically for surgery. I knew that I was going to have drains, and I really wasn't sure how I was going to feel the first week. I really wasn't sure the kind of movement I was going to have. So before I had surgery, like, I knew my scheduled date, I gradually moved my shot day to the day before surgery. And I did that because I didn't want to have surgery and then 2 days later have to do my shot, because I didn't know how I was going to feel. I didn't know anything like that. So you're allowed to move your shot date. You don't have to do it on the same day every week. You could do it, you say you're going to do it next week, do it 2 days later than the day you did this week. You don't have to do it that way. I moved mine 1 day at a time, 1 week at a time, until it was like where it should be. I don't know if that makes sense, but consider moving your shot date if you're on shots to like right before surgery, maybe the morning before surgery. It's not going to affect anything. It's testosterone, you know, we've been taking it. But consider that, because I really didn't want to be in a position where I had drains and I had to give myself a shot too. It seemed like too much going on for me, so I did mine right before, and then maybe, you know, your next shot you can do the day after you get your drains out. Just things will be a little easier. Every day after top surgery, it's easier to move. It's you feel better. So, you know, by a week when you have the drains out and everything else, you should be able to give yourself a shot, no problem. Or, you know, don't move it, whatever, have someone else do it for you. It's up to you. It's just one thing that I wanted to make sure that I did. What else do I have? So, another thing that I want to kind of talk about is mentally preparing to lose a part of your body. It may not be a part of your body that you like, that you connect with, that you ever want to see again. I know that my chest was, from the moment it started growing in as a very young child, I was absolutely not okay with it being there. But I felt that it was important to really mentally prepare myself for the fact that my breasts weren't going to be there anymore. Because they've been there, you know, for most of my life. It's still a part of my body. So as much as you don't like your chest, as much as you may feel dysphoric about it, say your goodbyes. It might sound weird, but just make your peace with it before it's gone. Because, you know, it can be kind of scary. I think one of the scariest parts of top surgery is going into it and thinking, okay, I'm not gonna look like this anymore. Like, I don't like how this looks, but I'm not gonna look like this anymore, and I'm gonna have these scars that I'm gonna have to get used to. So make your peace with your chest, say your goodbyes, and mentally prepare yourself that you're gonna see scars on your chest, because they can be kind of alarming at first. I think scars are scary, kind of, like fresh scars anyway. So I really had to do a lot of like looking at myself in the mirror with my shirt off, seeing my, boobs there and everything else, and seeing what they looked like, remembering what they looked like, making my peace with them. And then I had to look in the mirror and I had to envision my body with scars. It was just one of the things I had to do to prepare, because I didn't want to wake up and be like, oh my God, like, what the fuck, I mean, I don't know if anybody really feels that way, but I did. I didn't want to be too surprised when I looked in the mirror and have it be an unpleasant experience. It certainly wasn't, but I really wanted to make sure that I said bye to my chest. See you later, titty boobs, I'm all done with you. Peace out. So yes, just remember that a part of your body is not going to be there anymore, and it's going to take some getting used to. Another thing that I also did to prepare myself was I did not picture what my chest was going to look like. Anytime I started to think about what my chest was going to look like, I stopped, and I didn't think about it. I just had to stop myself, because the thing is that there's really no way of knowing what it's going to look like. You can't choose your scars, the shape of your scars, anything else. That's just kind of that. It goes by the surgeon. Your surgeon's going to tell you this is probably how it's going to be. They're going to explain it to you, but you really can't choose the shape of your scars or your nipples, like where they're placed. I chose a surgeon because I liked his nipple placement. That's like my number one recommendation if you're choosing a surgeon, but you don't decide. So I didn't picture what my scars were going to look like. I didn't picture my chest where my nipples were going to be. I just pictured it how it was going to feel physically. And that's what matters most. I mean, vanity is important to many people. Yes. It's important to me, but I could not allow myself to picture it, because I felt like that was going to cause me some anxiety, and I could be disappointed, or live in the moment. Don't think about it. Don't think about what it's going to look like. This is my advice anyway, and it really helped me, because when I saw it, I was just so I couldn't imagine it looking any other way. It was perfect to me, and I was very happy with it. I wasn't disappointed about anything, because I didn't set my expectations to a certain level with it. I know it's exciting and everything else, but if you're about to get top surgery, if you have top surgery planned, you're fortunate. You're at a part of your journey where other people wish they were right now. So just look at it that way. Just be grateful that you're going to have it. It's going to happen to you. You're working towards it. It's a goal. You're going to meet it. It's going to happen. Just don't set your expectations too high, because I really believe that causes anxiety. Stay in the moment. So yeah, those are my tips. The last one I'll leave you with is to hydrate, drink a lot of water. Your body needs it, especially beforehand when it's preparing for a serious surgery, and afterwards when it is recovering from a surgery. So yes, thank you. I hope I was able to help some of you, or maybe you just listen to me ramble, I don't know. But thanks. Please like, share, subscribe if you enjoyed. I really appreciate the support.